Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Hi, Dr. Darrow. Hi, Dr. Darrow.
I don't hear anything, guys.
Do you hear me now? How about now?
Now I do, Nita.
Hey, How are you?
I'm living it up. I was a little worried about you, though, there with your microphone.
I know. Well, we're together now, and I'm great, and you're living it up, and we want our listeners to live it up, right? So
absolutely.
We have a treat for you today. When you call the program, you get a free book. But let me tell you what the program is about first. This is about musculoskeletal pain or orthopedic pain, basically. And it involves muscle pain, joint pain, tendon pain, ligament pain, disc pain, back pain, neck pain, knee pain, hip pain, arthritis pain, any kind of stiff joints, dull aches that you may be experiencing that maybe you don't know where that's emanating from, and you can call the program all hour long, starting right now, and speak directly with Dr. Darrow at 866-870-5752. Right here in the studio, 866-870-5752. Please check out the website at www.lastemcells.com. That's www.lastemcells.com. You can email Dr. Darrow off of every page on the site, and you can see him performing the treatments on videos. We are here Saturdays at 10 and again at 1 p.m. And this book that you're going to get for free when you call the program is called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has 264 scientific studies, and the foreword is written by Suzanne Summers. And we have an office line to give you that you can call 24/7 if you're just ready, you've been listening, you want to book your appointment, go for it at 800-300-9300. That's 800-300-9300. So give us a call right now. We are here for you, 866-870-5752. What do you think?
Thank you, Anita.
You're welcome.
Yeah, I'm going to take a question. I get questions from the website all day and all night long. Inquiries about people that are thinking about coming into the office who want to know more. And the website to go to where you can email me on every single page is www.lastemcells.com. That's lastemcells.com. You go to that on the website. You can watch all kinds of videos and information you'll get about regenerative medicine, about what platelets are, what stem cells are, how they're used, and you have a chance to email me. So this is an email that just came in, and it says, hip discomfort and cancer. So let's see what's all up about that. Good morning, Dr. Darrow. I'm 62, blah, blah, blah. I've been experiencing sharp pains in my right hip after cancer treatment. That's possible. Chemo can do that to you. It does a lot of things to the body. Nita, you're a little squeaky back there. I'm still able to walk up 6 to 7 miles with little to no discomfort when walking, only pain after walking and resting. I do believe my lymph node caused the problem because of the location of deformed node cutting off blood circulation. I was in stage 4 at the time of diagnosis with B-cell non-Hodgkin's lymphoma. I'm fully clear of lymphoma B-cell infection as of current PET scan. That's great. I would like to know what are my options with stem cell therapy. Thank you for your time. And the answer to this is we have to take a look and see what's going on with that hip. And when we talk about a hip, that means a lot of things to a lot of people. So we have to distinguish what part of the body that person is talking to. Hip pain is generally in the groin, in the front of the body. I know a lot of people think it's in the back where their pelvis is, like right, if you put your hand behind your back, a lot of people go, this is where it hurts, that's my hip. And I go, well, that's not really your hip. That's your gluteus muscle. Usually it's the gluteus medius where it attaches to the pelvis. And that's something that can be fixed usually very, very quickly and easily using platelets or bone marrow. Bone marrow has platelets and stem cells, and blood has just the platelets. So we have to decide which way to go with that, depending on how bad the issue is. Also, what people call the hip is the side of their body where that little lump is. If you're skinny, you can feel it. And that little lump is called the greater trochanter. And to that lump, there are 14 muscle attachments. So that can get a little complex about where that pain is coming from. And unfortunately, a lot of people who have a little bit of arthritis in their hip get a hip replacement when it wasn't really the hip joint that was causing the pain. It may have been these other things that were causing the pain, but because the surgeon sees some arthritis, they haven't touched the body to find out where the pain is coming from, and they go ahead and then they replace the hip joint, which is not a great idea in my way of thinking. Why do something that is very invasive when you don't have to? These other areas you can fix very easily with injections. If it is the actual hip joint that is the problem, we often can help that by growing back the cartilage inside by using stem cells or PRP again. So this is complex. The fact that the person had chemo and I assume maybe had some surgery with that, I'm not sure. It didn't say what's going on here. They're talking about their lymph nodes. So I have to actually touch the body to find out where the pain is being generated from. And unfortunately, you guys who are my longtime listeners have heard me say this probably on every single show. When I get someone in who's had a failed surgery, that means they had a surgery and they got worse or didn't get any better, I ask, did the surgeon ever touch your body? And the answer almost 100% of the time is no. They showed me an X-ray, an MRI, or a CT scan and said that's what has to be operated on, when they don't even know if that is the problem. If we do studies on people that have zero pain, that's people that are totally pain-free, we will find problems inside with images. But they're not problems that necessarily cause pain. But those are the problems the surgeons operate on because they didn't touch the body to find out where the pain is coming from. Now, this is not a negative statement about surgeons. It's just sort of the way it works. They're looking for something to operate on, and they hang their hat on the MRI, the X-ray, or the CT scan when it may not be the problem. So be very careful if you're going to get a surgery for musculoskeletal pain that you have the surgeon touch the body to find out where the pain is coming from, or come to a doctor who does regenerative medicine, because we do the examination very, very thoroughly. Okay? So that makes sense, I hope, Nita, doesn't it?
Absolutely, yes.
Now, the fact this person had cancer is another issue and was on chemotherapy. I don't do anything with people who have had cancer unless we get something from an oncologist saying that it's okay to inject cells from the blood or from the bone marrow, because we don't want to take a chance of taking cells that have cancer in them from one area and putting it into another area. Even though this person says they're cancer-free, I have to go with what the oncologist says, and I like that in writing. Okay?
Makes sense.
So I'm going to give out the phone number right now to call me right now. You can talk to me. The phone number to the studio is 866-870-5752. I'm going to repeat it for you, 866-870-5752. I want to talk to you. I don't care if it's about you or about your friends, your family. You can use a fake name if you're shy. I don't really care. So I'm waiting for your phone calls. And if you happen to want to call at a time when we're not in the studio here, you can call my office. And that phone number is 800-300-3999. 800-9300. I'll repeat it, 800-300-9300. We usually have people by the phones, even on the weekends, if you want to call. And if you give us a call, we'll send you a free copy of my book, Stem Cell and Platelet Therapy. And then the byline is the most important. Regenerate, don't operate, which means there's how many studies in here? 264 studies, I think?
Yes, 264.
Showing that it's a lot easier to get an injection to regenerate the tissue and rejuvenate it and heal it rather than to cut the body open and take things out and rearrange them, because the sequelae or the side effects from surgery can be drastic. I see it every single day of the week in my office, where patients were offered complete healing by doing a surgery and they come out a lot worse. And unfortunately, I'm one of those guys that it happened to. During my 4th year of medical school, I injured my shoulder weightlifting, and I was doing orthopedic surgery, so my boss did my shoulder. He's a great surgeon. I love him. But the surgery came out bad. And I had a useless shoulder for a couple of years until I discovered regenerative medicine. I injected myself. I woke up the next morning completely pain-free. If you come in for treatment, don't expect a quick healing like that. That's not the norm. It's happened to me on a few places on my body that I've personally injected myself. But sometimes some areas that I've injected in myself have taken months to heal. There's just no rhyme or reason to it that I understand yet, and I've been doing this over 20 years. It's just hard to give a prognosis on healing to anybody for anything. Medicine is a strange bird, you might say, and we think it's supposed to be scientific, and I'm finding out that I'm not sure it's science that guides it. It's more of a spiritual thing that comes with that particular patient. And yes, I love science. I was a born little scientist, always doing experiments as a little kid. I loved the science fairs, and I have some great stories about that sometime, but not for the show. And let me see if we have any callers yet. No, so let's give out the phone number again. It's 866-870-5752. Please call me now. Let's talk. By the end of the show, we're jammed and we won't be able to get to you. So now is the time.
Now is the time. And when people call, they're helping other people that are listening that can't call.
So I'm going to go to another question here, Anita. It's called failed meniscus repair surgery. That's what I was talking about. Let's see what the person says. Hello, Dr. Darrow. My name is, I won't give it out. I suffered a bucket handle meniscus tear and attempted to repair it surgically. After 2 failed repairs, I decided to get a meniscectomy after the 3rd injury. Meniscectomy means they just clean out the entire meniscus. The meniscus is a cushion. It's like a pancake between the bones and the knee that cushion the cartilage. I'm extremely active and want to remain so, but here recently I've felt some weakness in my knee that I believe is a result of my injury and worry it will eventually blow out the rest of my knee. I'm interested in learning about any potential treatments that will improve my situation. I have heard of your stem cell treatments as well as HGH, that's human growth hormone, and other hormonal supplements. I would love to talk about it further. So let's see, I emailed this person back. Let me see if they responded yet. Nope, they haven't responded yet to my email to them. But the bottom line is, in my personal experience and looking at all of the science, the studies that are done, the thing that's most important is getting some of your own body cells into that joint. And HGH, human growth hormone, may be an adjunct to this. There's not enough science to know that that's going to really help. Anecdotally, that means, we do something and we think it helps. Yes, there's a lot of people, a lot of doctors who use HGH. I don't do that. Other hormonal supplements, I think that can be helpful. As we age, our hormones do decrease, and I think it's good to be tuned up. If you're a woman with progesterone, testosterone, estrogen, and for a man it's usually just testosterone, but that's a whole nother story. And I think the answer to this knee with 2 failed surgeries after two, is this 2 or 3? I think it's 3 failed surgeries.
Ouch.
I don't know what that doctor was thinking about, because, after 1 failed surgery, the percentage of failures goes way up. So I wouldn't have done the surgery to begin with. This person is still active. The people I send surgery to are those that can't move a joint. When it's totally locked up and bone on bone. What does bone on bone mean? It means it's locked. It means it's like 2 bricks trying to slide. They don't slide. And I get people that, they don't, right? 2 bricks don't slide on each other.
No, they don't. That's true.
And that's what, I hear it every day from patients who come in. I have bone on bone. I don't know what to do. They want to do a joint replacement. I move them around and they have no pain. And I go, you don't have bone on bone. And they go, yes, I do. I saw it on the x-ray. And I go, well, too bad. It's not bone on bone. X-rays lie, MRIs lie, CT scans lie. I mean lie in terms of they don't tell you how you feel. They don't tell you what you can do. I've seen terrible MRIs, and I thought, my God, I can't even help this person. Then I examine them, and they have full range of motion. They're pain-free during the examination, and it doesn't make sense, does it? But that's the way it is. I'm sorry, I didn't create MRIs or what people think about them. So, you need an examination, and that's the only way to really know what's going on. I had a gentleman that Nita knows. His name is Terry McNally. Hi, Terry. Hope you're listening. Terry's a great guy. He went to Harvard University, and he had a total meniscectomy after a football injury there. And when I looked at his x-ray, the femur bone, the bone of the top thigh bone, did not even fit exactly on the tibia bone, the leg bone. And we got him good enough to dance, hike, and do yoga, which was his goal. And he was pain-free after our treatments. So, Terry, God bless you. I hope you're still feeling good. If you're not, come on back. It's been years, maybe 20 years since I saw Terry. I don't remember when it was.
Well, we had a caller named Mike, but he disappeared. So, Mike, please call back on 866-870-5752. That's for all the rest of you as well. That's 866-870-5752 right here in the studio. And you can speak directly with Dr. Darrow and find out what's going on with your pain. You didn't say my favorite word yet today.
Enthesopathy?
That's the one.
We haven't gotten to a back question yet. When we talk about the back, it's typically an enthesopathy. The low back has ligaments called, you could write this down if you want and look them up on Google. You can look things up anatomically on Google by putting in the word and then clicking on images in the upper left-hand corner. And it'll show you pictures of what it is you're looking for, and then you can click on them and blow them up. So in the low back, we have mostly enthesopathies, even though surgeons may see a herniated disc or something of that nature that looks terrible that they operate on, then the person doesn't get better because it wasn't the problem. So, with the low back, most of the people that come in, even with terrible low back pain, even with herniated discs, even with facet arthropathy, all of these things that people get surgeries for, even with spinal stenosis, we check with our hands, I push, and I find out where the pain is coming from. Most of the time, it's from the interspinous ligaments and the iliolumbar ligaments, or where the quadratus lumborum muscle attaches on the pelvis there. So we have to be very, very careful. If you're going to get surgery, before you do it, make sure the person doing it touches your body, or go to someone who does regenerative medicine like I do, who uses PRP and stem cells, because we're looking for the spot that causes the pain. And where that spot is in the low back is where those ligaments attach to the pelvis, or where the bones attach by way of ligaments. Ligaments are pieces of collagen that hook bones to bones. Tendons are pieces of collagen that hook muscles to bones. Either way, at the attachment of the bone is what we call the enthesis, and when there's something wrong with it, when it hurts, when it's sprained, we call it the enthesopathy. Now, the interesting thing, and I laugh all the time when people have one of these enthesopathies, they're ready for a back surgery or something very dramatic and very, in my mind, very dangerous, I say, all you have is a sprained ankle in your back or your neck. And they go, what are you talking about? I saw the MRI. The surgeon showed me all of these terrible things. And I go, none of those things are causing your problem, causing your pain. And then I have to re-educate the person as to what's really going on. Sometimes I'll spend an hour with the patient because they just don't get it. They've been so indoctrinated with the surgical culture that we live in, which is now moving away. We're now moving into regenerative medicine more and more and more. And thank goodness, because it's easy. You walk in, you get injections, and you walk out. How simple is that?
Simple.
Chance of infection is very, very low. And, we always tell your story, Nita, about your neck pain.
Yes.
And how you healed so quickly by getting regenerative medicine about, 15 years ago or something like that?
Yeah, it's about 16 years ago now, and I had neck and shoulder pain.
That's when you were only 6 years old, right?
I was a little teeny thing, yes. And no, I was 16 because, now I'm 28. I'm not a math major here, but what happened was...
It's okay, but you still look good.
Well, here's the thing. No, you touched the back of the neck. I about flew off the table. The pain was so bad, but that's how you find the trigger point of the pain. And then when you treated that area with the shots, I was better in a week. That's what happened. Well, I know not everybody might get that kind of result, but that's the result I got. And I'm grateful. And we're here at 866-870-5752. That means you can feel better, too, right here in the studio. Give us a call, 866-870-5752. Wouldn't you like a free call with a doctor who might be able to help you with your pain? Come on. Yeah,
you may even be able to help your surgeon learn something. And
you get a free gift. Yeah, right. Yeah, and you get...
I'm not trying to be diminutive about surgery. It's something that's great when you need it. If your leg is broken and the bone is sticking out, you better run, if you can, to the surgeon. But most of these musculoskeletal surgeries, for meniscal tears, rotator cuff tears, things of that nature, in my opinion, should never be done. They just don't have a great outcome. I'm the prime example with my shoulder. I was shocked. I was in training to be an orthopedic surgeon. That changed my mind real quick. So I have another question here, Anita.
Yes.
This one says shoulder replacement. Okay, it's short, so it's easy. Been told the only thing that will help my bone-on-bone shoulder is a complete shoulder replacement. So, I'm going to start off on the negative end of this. I have seen people with complete shoulder replacements that can no longer even move their arm, where the prosthesis doesn't work. Prosthesis is the fake joint they put in. And then they're done. Again, I'm going to talk about this. This person said, on my bone-on-bone shoulder. I'll bet you anything it's not bone-on-bone. If you can move it, there's some cartilage in there. A question I get all the time is, there's very little cartilage in my joint. How can the stem cells get in there to heal it? Because it's liquid. They go everywhere. It's very easy to get them into the joint. I use an ultrasound. That is a device that's an imaging device. This is not a physical therapy ultrasound. It's an ultrasound that I use instead of an MRI or a CT scan to look inside your body. So I look with the ultrasound. When I'm injecting, I can see exactly where that needle needs to go. When doctors do what I'll call blind injections without an ultrasound, they are missing that joint typically 1/3 of the time. If they're sticking a steroid shot in there, meaning cortisone, oops.
Okay, hold that thought, Dr. Darrow.
Oops.
You're listening to Living Pain-Free with Dr. Marc Darrow. Please grab a pen or a pencil. Write down this important information coming your way. I'm your host, Nita Valens, and we'll be right back after these messages.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.